I'm Patty Stalker here from WestfordCAT, and I'm with Jeff Stevens. He is the health director here in the town of Westford. How are you, Jeff? I'm assuming busy.
Yeah, we've been pretty busy for the past year, but we've always got time for you, Patty.
Thanks, Jeff. Yeah, I appreciate it, and so does everyone at WestfordCAT. You certainly give out a lot of great information on our semi-weekly health updates. Um, so you just said about a year's time, and since this COVID-19 virus has been raging through the United States, and we reached over a half a million people dying from this virus. That's an awful number and almost unfathomable.
Yeah, and that was actually one of the first things I wanted to bring up and just remind people that a half million people in about a year's time did pass away from uh, having COVID or died while having COVID, and it's an unbelievable number. I mean, some of the comparisons that some of the news agencies are making to the world wars on people that have passed away, it's just amazing that we've gone through that much tragedy and that many families have gone through that much tragedy. And what's important is we're still in that battle right now. I know vaccine is rolling out and I know people are starting to get vaccinated. But one of the most important messages that I could really put on anybody at this point is that we still need to hold the line on social distancing, wearing your masks, washing your hands, making sure you're staying out of gatherings when you can, and staying home when you can. It's still really important. And we're still seeing infection rates. At this point, we're very lucky that they are starting to subside, but they haven't stopped. And that means it's still there and the potential for infection and death still exists. So we still need to make sure we're doing all that we can to make sure that we're protecting ourselves. And people need to take responsibility for themselves and make sure that they're doing those things as best they can.
Right. I mean, we're all weary. We're all weary of this. It's been a year. And I too worry that people, because of the vaccine and because the numbers are starting to go down a little bit and because they're weary, they are going to let their guard down. And I agree with you. We just can't do that. We have to stay the course for sure.
There is no doubt COVID fatigue in the community, in my office, in every other office where people are dealing with COVID and the rules and the regulations on a regular basis. It's a lot, and there is light at the end of the tunnel, but it's still, as I've said before, a long tunnel, and we're not quite there yet.
Absolutely.
We're getting closer, um, and there are mass vaccination sites that people can register online for when they go to mass.gov and you go to find a vaccine site. You can find places to register. I know that process has been slow. The town of Westford has been very frustrated by the fact that we haven't been able to get vaccine, but we share frustration with many, many other communities because it has not been sent to the local communities as we would like to have it sent to us. We know our population the best. We know where we need to get it to, and we've got the capabilities and the tools. We've been training for years on this. So for us, we're ready. We just need it. Uh, that said, when people do get vaccinated, which is great when you do, you still are going to need to follow all of the exact same rules from the travel orders to the social distancing, isolation, and quarantine for the time being. The CDC in the state has not lifted the need to wear your mask once you're fully vaccinated.
So even if you get your two vaccines, you still have to follow the rules on, like you said, social distancing, wearing a mask, the travel restrictions, quarantining, et cetera, even with two vaccines.
With two vaccines and 14 days after your second shot, you still need to make sure that you're putting your mask on. That doesn't go away. We are hearing reports that people that are fully vaccinated are still getting COVID, but are not either showing symptoms or have extraordinarily mild symptoms, which I know frustrates some people, but a vaccine doesn't necessarily protect you from ever getting sick. It reduces the risk of death or hospitalization. And that's what really the goal is to make sure that if you do get sick, you're not going to get really sick. And that's what the vaccine is doing. So that's what we're hoping for. And that's why we need to still continue to take those public health preventative measures as much as we can.
Right, because if somebody can still get it, they're not exhibiting symptoms. It's just like people that are asymptomatic, that don't have the vaccine. You wear that mask to protect others. So that's good advice. Now, the vaccine itself, I know you can go on mouse.gov. It's people 65 and older, people with 2 or more comorbidities, first responders. There's a list of all of them on the website here. Long-term care setting workers, healthcare workers, people, low income and affordable senior housing residents, and healthcare workers. So, so if you are eligible for the vaccine, you go to mass.gov, and I think you can put in your zip code, correct? And it will show you sites near,
Yes.
like near Westford, where you can get it. But what you're saying is the town of Westford doesn't have it itself. I think Lowell General had it, the vaccine, for a while. But you had talked a little bit about a collaborative with some other towns in the area. Can you fill us in on that?
So yeah, right now we're just turning over every stone we can to look for ways to get vaccines to residents. And currently we're working with some towns to the south and to the east of us, which would include Burlington and Sudbury, Wayland, Acton, Maynard, towns that are very interested in running a large-scale vaccination clinic. And it's going to be a heavy lift if the government actually says we can do that. If the state says we're allowed to run that clinic, we'll do it. We're not going to know that for a little while. We're just getting that organizational piece put together right now, and the request is probably getting sent in the next couple of days. But we're going to try to just find other ways to potentially get people vaccinated and give more options. I mean, currently, people in phase 1 can get vaccinated, and right now in phase 2, people over the age of 75, and like you said, 65 and older, people with 2 or more health conditions that are listed on the CDC website, and people that are in senior housing, senior affordable housing, and the workers in there can be vaccinated. To give you a quick update on what Westford actually has done with vaccination, we have done a full-scale, multi-town mass vaccination clinic for all of our first responders, which is our police, fire, EMS, and dispatch, which was very successfully completed with Tingsboro, Tewksbury, Dracut, Billerica, Chelmsford, and Westford.
And did they get both vaccines?
Both vaccines are done, and they've been completed.
Awesome.
And Westford Housing Authority is already set up with a pharmacy, which that population in those particular units are going to get vaccinated that fall within the guidance for that particular sect. Everybody else that is 65 and older and people with 2 or more health conditions are able to go to Lowell General Hospital's facility at 1001 Pawtucket Boulevard if they register ahead of time. Or they can go to one of the other state's mass vaccination sites, which you're able to get appointments for. I believe it's every Thursday the state loads in more appointments so they can get more people in. And if you do need help with that particular site, Mass 211 is a great option. It's something that a lot of residents are finding very useful. There's people answering the phone that are able to get you the appointment, and they're able to make sure you know where you're going. So if people do not know what to do or they have computer trouble, Mass 211 is the way to go. Additionally, the Cameron Senior Center is helping people with vaccine appointments, most specifically in Lowell. So if you are a Westford resident, you are interested in getting vaccinated, you fall into the current categories. The Senior Center may be able to help you if there are open appointments, if you need help getting registered. They've been fantastic and a great partner in making sure that they're getting our most vulnerable populations done.
Yeah, Jen Claro and the rest of her staff are really great over there at the Cameron. They're doing a really good job. I know that they've helped a lot of people already. So thank you for pointing that out. Now, people can also contact the health department if they have any questions, Jeff, correct?
They can always contact us if they have questions. We'll do the best we can to direct what their questions are and get them to the right people, or just get them information on how to get onto the vaccination websites.
Well, I know it's been frustrating for residents, but I'm guessing it's more frustrating for you and your staff with the delay in the vaccination. So we really appreciate all the work that you guys are doing.
Well, we're working as hard as we can to get it. We're using all our resources to do so. And when we get the opportunity, we'll be more than happy to vaccinate as many people as we can. The good news is frustrated as many people are with the rollout, is people are getting vaccinated every day. Mm-hmm. And there are a lot of people that are getting vaccinated every day. In fact, I think there's over 1 million people that have received their first dose already in the state of Massachusetts.
Wow, that's a big number.
That was this morning that they had announced that. So it's probably a little bit higher right now. And one thing that makes me feel a little bit better is that the amount of people that have had COVID-19 is less than that. It's around 550,000, I believe.
Great.
So we vaccinated more people than have actually been sick. And I'm hoping as that trend continues, we see the COVID numbers drop and we see an opportunity to return to some normalcy at some point. I don't foresee that in the very near future. And we still don't know what's happening with some of these variants of COVID-19, how they're going to respond to vaccine and how fast they're going to spread throughout the community, which is another reason why, with a wild card like that out there, we really have to pay attention to what we're doing and not let our guard down, especially families with kids on sports teams, making sure that they are not going to family parties, they're staying away from people, they're doing the right things and following guidance the best they can. It's really important. And it also, when people decide to do their own thing and people get sick, it ends up making an awful lot of work for other people to do the contact tracing. Mm-hmm. If people will answer the call and do the contact tracing, it's a huge help to us. It helps other people not get sick, and we're able to get people the information they need. So if you're contacted by the contact tracers, give them the answers they need, give them work with them. It's not a punishment. It's just a minor pause in your life for sometimes as little as 7 days, as many as 14. And hopefully people aren't very sick. And if they are, they recover quickly. We're actually all on the right track. It's going in the right direction. And people got to remember that. Stay positive and stay negative.
I like that. That's great. Did you make that up?
I think I stole that from somebody a long time ago. I don't even know who it was, but I liked it.
I like it. That's pretty good. Yeah. Stay positive, stay negative. All right. Good stuff, Jeff. We'll touch base again when we have a little bit more information on the vaccine or if anything else should change.
All right. Sounds good, Patty. Thanks for having me.
Yeah. Thanks a lot for your time. For WestfordCAT, I'm Patty Stalker.